Okay, we'll go ahead and get started. Welcome to the NRTRC Monthly Open Mic Webinar. I'm Martha Nikitas, the Program Coordinator for the NRTRC. We'd like you to make use of the pods surrounding the slides. There is a pod to the right where you can visit our website as well as participate in our post-webinar survey. Below that is the pod where you'll find a copy of Greg's slides for today as well as the save the date card for our next conference. Please use the chat pod for any technical questions or concerns, and the Q&A pod is for entering any questions you have for Greg during his presentation. He'll be answering those at the end of his talk. Our webinar for next month is being presented by Cindy Roloff from Afghan in Alaska on Telehealth 101. With that being said, let me introduce our speaker for today. Greg Janes is the Director of Marketing at Telepharm, a growing company focused on bringing pharmacies and healthcare access to rural areas. Greg graduated from Iowa State University with a bachelor's degree in marketing and went on to receive his international MBA from the Monterey Institute of International Studies in California. He has extensive experience in economic development and is passionate about using technology and innovation to improve healthcare access in rural areas. And I'll let you take it, Greg.
Great. Thank you, Martha. Can you hear me fine?
I think you said great.
Great. Okay. Well, first of all, I just wanted to thank you and the NRTRC for inviting me to do this webinar with you guys today. I know I'm excited to spread more awareness and education about telepharmacy up in the Northwest. There's a lot of opportunity in the states that the NRTRC works with, and so glad to have the opportunity here to get in front of you and your membership. So we have a few slides here, and I'll kind of take my time going through them and talk a little bit about some different aspects. And then like she said, we'll open it up for questions at the end. Usually I don't like to drone on too long, so it'll probably be 35 minutes or so, and then we'll have some questions, and then we can wrap it up after that. So first of all, we'll just kind of quickly, run down what we're gonna cover today. We have, the origins of telepharmacy, kind of where it came from, the history, why now, why it's important to look at now, what the process is, and how telepharmacy works in the definition that we use, what the regulatory environment is, and we're gonna run through the regulatory environment in all the states that the NRTRC covers, and then the future applications that we see. So to start off really quick, what is telepharmacy, and what are we talking about when we reference telepharmacy? And there's a few different definitions and a few different ways that it's applied, and it can be a benefit to the healthcare system. But the two main components that you typically see in any kind of telepharmacy setup are the prescription verification side of things, where a pharmacist is either verifying an order, checking for drug interactions, things like that, or they're verifying a prescription that's being filled. We also have the counseling and education part where you actually have that live video connection between the pharmacist and the patient, where that pharmacist can then do all those clinical activities and counsel the patient on the meds that they're taking. Um, our focus for today's presentation is going to be mostly on the remote dispensing telepharmacy side of things. There's a few different, I guess, terms and references that you hear out there in the market. So there's telepharmacy that is just the order entry review in an inpatient hospital setting. We complement that. We're a telepharmacy on the remote dispensing side, which would be for outpatient or discharge pharmacy. And then or on the retail side. And then there's the telepharmacy that's used to talk about the remote counseling, just the remote counseling piece. That can be used to provide specialty counseling, discharge counseling, anything like that, where you're connecting that pharmacist and giving them the ability to see more patients and speak to them and educate them more often. So a lot of times people are just talking about that side of things, and there's a few other very interesting uses for telepharmacy that we're starting to see kind of grow now in the marketplace. And one of the big areas that we're seeing is the IV telepharmacy is another really interesting and very good use for telepharmacy. And so if you want more information on any of those different types of telepharmacy, definitely let me know, and I can provide you with resources information for all those different types. Today we're going to talk about the outpatient or retail. That's really what's been growing here in recent years and really starting to take off. So let's rewind back and start looking at kind of where this came from and why it's something that we're looking at and seeing grow today. So looking at the history, we go way back. The first known telepharmacy that's on record is in 1942 in Australia, and their Royal Doctor Flying Doctor Service. They would take a medicine cabinet with them, hop on a plane, and fly out to these very rural areas in Australia. And as you know, most of the population or most of the land mass in Australia is considered very rural, except for the coast and some large coastal cities. And so once they got out to these sites and the doctors would see the patients, they'd call back to the pharmacist and speak to them and find out, what should they be dispensing, what should be giving the patients. Um, and we haven't done really in-depth research, but there isn't a whole lot out there until the early 2000s when the U.S. really picked this up, and that started here in the U.S. It really began in North Dakota. North Dakota saw that there was a need, and they were the first state to work on passing laws that would allow for telepharmacy. And along with that, they worked with their with North Dakota State University to do a study on telepharmacy, which started in 2002. We also see a few other telepharmacy programs start up in Spokane, Washington, and Alaska. And then the largest telepharmacy implementation to date is actually with the U.S. Navy. It started in 2006, and they have the largest network of telepharmacies on Navy bases throughout the world. And then we like to toss in there that, of course, a new generation began in Iowa in 2012 when our company was founded, because we think we're disrupting and kind of changing the way that telepharmacy looks and works, and hopefully that'll have a really good impact on the future. So circling back to North Dakota and the telepharmacy where it started there, because that really kind of blazed the way for where things are today. They were again the first state to pass a regulation. It was in response to the rural community pharmacies closing throughout the state. It became a really big epidemic in North Dakota, and they started looking at solutions to try to keep pharmacy access in rural areas. And so they teamed up with North Dakota State University and the College of Pharmacy to do a study that was federally funded. It lasted from 2002 to 2008. And in the end, it included 81 pharmacies that were both retail and hospital pharmacies. And the lesson that we learned from that and what we took away from that very extensive study that they did is that telepharmacy is safe. It's a safe and effective solution to keeping pharmacy access in rural areas. And in fact, their dispensing errors were much lower than even the national average, and they chalk that up to the redundancies and a lot of the extra checks that are put into place throughout the filling process. So they overall it was very positive, and it proved that it was a safe way to deliver these services. But of course, this is back in 2002 to 2008. Technology isn't what it is today, and we saw a few limitations from the way that they were doing it. Obviously, this is great for a federally funded project, but they had large bulky equipment that now looks very dated. You can see some of the pictures here, the large TV screens, these huge cameras, just very bulky equipment that was quite costly at the time. And you also needed really extensive bandwidth for your internet connections. It was a very difficult system to get up and running, and there was a lot of restrictions because of that. And it was also pretty much limited to point-to-point, one-to-one connections. There was also a lack of documentation. It was hard to scale. So there was some problems with the early technology. But like I said, everything has changed and advanced, and so we're seeing this kind of take off now. The other thing that's really started to play into the reason why this is starting to become more and more apparent and more important is starting back. This actually starts back at the beginning of that North Dakota study in 2003. This is the data that the Rural Policy Research Institute started to collect. And here, the rural independent pharmacies that were closing, they've seen a drastic decrease in this. In fact, since 2013, we've stayed in touch with them, and they've continued to see declines. And of course, I highlighted here 2007 to 2009, which was our economic downturn. There was a number of pharmacies that closed during that period. So really, what we've been seeing is, especially in rural areas, these pharmacies are closing, and it's creating areas where there is no access to pharmacy. And so this is not something that's just limited to the Northwest or the East or the Midwest. This is something that's all across the country. These pharmacies are closing. And the stat that I always like to point out here that really rang true to me when we first started getting into this was that 490 communities during that time frame lost their only pharmacy in their community. And many of those would be considered now pharmacy deserts, which you might hear me reference a few times throughout this presentation. But a pharmacy desert is a community that's 10 or more miles to the nearest retail pharmacy, and that means those residents have to travel at least 20 miles or more in order to get their prescriptions, and many times they're doing it multiple times a month. So these industry changes and what we're seeing with these closures really started to put pressure on people to figure out, what can we do? How can we solve this? You know, what are the consequences that we're seeing from all these pharmacies closing? Well, you're starting to see a gap in the healthcare in these communities, and especially in rural areas. But it also applies to urban areas as well. You're seeing this fragmentation of care where people can't get consistent care, and patients are going to one place for medicine, one place to see a doctor, another place for another prescription, and it's creating these these pockets where there's no good consistent communication between the different sides. You're also seeing a dying Main Street. I know this picture here, it seems a little bit over the top, but a lot of rural communities, that's what you're seeing. They're starting to close down. And it's hard on all these communities when a business leaves, especially a healthcare related business. And of course, the jobs that were created in these rural areas by those pharmacies being open and operating in those communities. And then the biggest one, which I have another slide of here in the next slide, is this idea of decreased medication adherence. And there's a huge there's a huge movement right now to try to prove that when patients have convenient access to medication, they're actually more adherent. And what we're seeing is this medication adherence is a huge problem. If you haven't known about this, or you haven't heard anything about it, it's a 290 plus $300 billion problem every year. 13% of all healthcare spending is on avoidable costs associated with medication non-adherence. And the stat that I'd like to point out here is that 31% of new prescriptions go unfilled, and in fact that gets worse. Only 50% of patients, so 69 to 70% of patients fill their prescriptions, but then 50% of those take it as prescribed, and then only 15 to 20% of them refill it as they're supposed to. So we start to see a really poor medication adherence over time. And there's some studies right now that are taking place to try to look at the difference when patients have convenient access versus when they live in an area that doesn't have convenient access to that pharmacy. So we'll come back to some of these statistics later in the presentation as well. So moving on now, we're going to kind of fast forward now from the history and move more into the last few years and what we're seeing present day. And so we like to throw this out there and start out by saying, technology is changing. Where the world was 4 years ago, 5 years ago is very different. We're seeing companies like Amazon, start to reinvent the way that we look at retail online shopping. Obviously Apple is a huge one, and reinventing the way that we interact with hardware and devices, and they've really disrupted a number of different markets. And then, Uber has been a leader in changing the way that we look at public transport and the way that we look at on-demand type services. It's pretty cool. So technology has really brought about a lot of change, and I think as telehealth practitioners and people interested in telehealth, everybody can understand that technology is impacting the healthcare industry as well. So what we saw, originally, and there's still some of these hardware-based solutions out in the marketplace. A lot of the original solutions to telemedicine, telepharmacy, telehealth in general were very hardware-based, and we did that out of necessity. I mean, that was what was required, but it's also very costly. That's one of the downsides to hardware, and it outdates very quickly as well. And so what we've seen is this shift towards more software-based solutions where the hardware component is just the portal to getting access to the internet and to cloud-based services. And we see this through all kinds of things. I mean, even the meeting that we're having right now, that this webinar is hosted on, is something that's software-based, and it's allowing us to connect and enjoy these technological developments. Um, and so what that allowed in the telepharmacy realm is now, instead of just having this point-to-point or one-to-one connection with a pharmacist, we can start to create these network of pharmacies where the pharmacists, it can be a number of different pharmacists, everything from specialists, maybe in dietitians, to HIV specialists, to anybody with any type of specialty, maybe a diabetic specialist. You can connect them to any pharmacy, as well as hospitals, health systems, clinics, anything like that. So we're starting to see the pharmacists become more and more accessible in all of these different places. And and so you can actually create these dynamic workflows where pharmacists are able to access not only a remote dispensing site, which is kind of where we focus a lot of our time and energy because we're trying to bring access back to these rural areas, but pharmacists can be connected to different sites, to the hospitals, to the health systems, all of these different locations working in unison to bring connected care to those patients throughout the healthcare system. Um, so what do these look like? And a lot of people are really interested, well, what does a remote dispensing site or what does a telepharmacy look like? And in our case, these are physical locations that look just like any other independent pharmacy that you would see anywhere in the US. Obviously, it's not going to be a Walgreens or Walmart. It's not going to be a huge facility, but it'll be a physical brick and mortar facility on Main Street in a small community. This picture is in the grand opening at Victor Drug in Victor, Iowa. It was the first one that our company opened. That's actually the governor there in the middle, with the lieutenant governor at the grand opening. And inside, you can see it's a little bit smaller than what you might typically see from an independent pharmacy, but it has a full drug inventory that's going to be tailored to that local population. It also has an over-the-counter inventory, obviously a lot smaller than the rows that you'll see at a lot of these larger pharmacies, but it's what the community needs, and it serves the needs of the residents right there in the local area. So it looks just like any other pharmacy. The only difference is you wouldn't see the pharmacist on site. You'd see the technicians behind the counter working, but that pharmacist would be at a central location verifying the prescriptions. Here's another example in a health system up in Wisconsin. This is inside of the clinic or the children's hospital in Delafield. The pharmacy, again, you can see it looks just like a pharmacy you would normally see, with the drug inventory back in the back on the shelves. There's an over-the-counter non-prescription medication vitamin section, and then we also have a picture here which is kind of nice. This is their somewhat isolated counseling area where they have the tablet sitting there on the desk. And that tablet in our setup, that's how the patients will actually connect with the pharmacist and speak to the pharmacist privately. They have a small device that looks like a telephone, and they'll have a private video consult over there where they can speak to the pharmacist and ask them any questions that they have. And they're available to them all the time, whenever the pharmacy is open, not just when you're picking up a prescription. You can speak to them at any time. So really quick to kind of recap some of the benefits. Obviously, telepharmacy in whatever way it's being utilized, it's providing access to this healthcare provider. The pharmacist typically has the closest relationship with those patients. They see the pharmacist more often than any other healthcare provider on the team, on the patient care team. It also prevents having to travel long distances and make extra stops along the way, which we find that even a small trip, maybe even a mile away across town, a lot of times will prevent that patient from picking up their medication or being adherent to their medication. And in fact, it reduces the dispensing errors as we've seen. It actually helps the patients stay on time, and that relationship with both the pharmacist as well as the pharmacy technicians on site really helps overall the achieve the best outcomes for the patients. Um, so kind of circling back to what I talked about earlier with the medication adherence, this is a big thing right now that telepharmacy and a gap that telepharmacy is helping to fill. So we're seeing that telepharmacy right now is creating that integrated healthcare system where where patients can receive their medications easily at the same location. Kaiser Permanente actually did a study out in California, and I had mentioned earlier that 31% of prescriptions go unfilled. With this study that Kaiser Permanente did, they gave the patients their medications right there on site, and they got that number to 5%. So 95% of patients actually filled their prescription, which is a huge increase, which is really really good for that patient and for overall their medical outcomes. So what they saw through this study is that better integration of these healthcare services means better adherence, and that, of course, is a huge benefit to the overall healthcare system. Um, some of the common questions that we always get, and I'm sure there'll be some more as things go along here, but some of the common questions that we get is fill accuracy. You know, are we making sure that those drugs are filled accurately? Um, I would say, I mean, our answer is yes. There's the North Dakota study proved that it's in fact even there's fewer dispensing errors than at a traditional pharmacy, but most of these systems now these newer systems that are coming out are allowing for image-based workflows where you're actually taking images of the prescription so you can keep records. But everything is very, very detailed as far as the audit logs and the process as it goes through. There's also barcode checks. So there's a lot of built-in redundant checks and double checks and system checks that all make sure that the right prescription is being filled and given to the right patient and going out the door. Another question that we get a lot is staff and location safety. Are is the staff and the location going to be safe and secure? And really, what we've seen in these smaller towns is they take care of each other. Like everybody in town will know the person who's working at the pharmacy. They'll know what's going on with who, where. They look out for one another, and that's really the advantage to having these people, this close knit community in these rural areas, is they very much take care of each other. And there are built-in safety protocols, extra safety protocols that are built into the policies and procedures of any operating telepharmacy, including panic buttons and alarms, things like that. We haven't had any issues with the security and safety at any of our locations. Um, Obviously, people always wonder the potential for diversion with no pharmacist on site. It's the same at any other pharmacy. There's cameras that are watching everything. There's inventory checks. Everything is documented. So, we also as a company, and I think a lot of people in the industry are pushing for certification of all pharmacy technicians and licensing as well down the road, which will also help with with that potential. But we see with perpetual inventories and other safety checks that you really don't see those types of things happening. There's always a policies and procedures for internet outage, but any operating pharmacy as well as almost any business can't really operate without internet. It's amazing to see how reliant we've actually become on this. The bandwidth requirements that most of these modern telepharmacy systems have is much much lower than it used to be. And so getting out to these rural communities has not really been an issue. And I think just to throw some numbers out, our bandwidth requirements are somewhere around a meg down and a half a meg up for our minimum requirements. And a lot of companies you're seeing are focusing on minimizing the amount of bandwidth that they need to operate, so that way they can have a backup in case the internet goes down. Some of the locations that we work with will actually use 3G or 4G wireless connections to run as a backup in the event that their main internet connection goes down. But if it does go down, the pharmacy is going to shut down regardless for a little while because they can't run any prescriptions through. They can't get a lot of electronic prescriptions, which is how the majority of prescriptions are coming across now. But there is protocols in place, and it is something that it does happen on a rare occasion, and there is preparation and plans there. And then, other people also ask, how does this apply to retail and some of these other places? Well, obviously we can go back into small communities. We can go back to places that are underserved, that people didn't think it could support a pharmacy originally. And what's really cool is we're seeing a lot of other applications for it in federally qualified health centers, in long-term care facilities, and in health systems. They're using it in emergency rooms. They're using it in these small clinics that are in these towns that don't have a pharmacy. They're putting telepharmacy in with the clinic, and that helps to bring that full primary care service right there to the local community. And then, you know, when you get a local pharmacy back, we a lot of people that we work with call it one of the quality of life services in the community. It provides one of those anchor services that you really need in order for a small community to survive. So you're going to need a doctor, a pharmacy, a bank, a grocery store, some sort of general store. Those are the major things that, like, actual commercial services that people are going to need to even consider staying in town in order to do all their shopping, or take care of their needs. When those things are missing, and the pharmacy is one of those things, then obviously they're going to have to go out of town to get some of those things. So it can really improve the quality of life and become one of those anchor services. It just provides that full primary care on a local level. You have businesses rebuilding on Main Street. There's local jobs created. Of course, the increase in medication adherence, like we saw, when it's more convenient and it's right there accessible, patients are more likely to fill their prescriptions, and they're more likely to be adherent. And we did a quick study with the Rural Economic Technical Assistance Center in Illinois, and they found that the economic impact of a pharmacy on a county level is about $640,000 for a telepharmacy, which is pretty great. And it's much larger than we had actually predicted it to be, but it does have a pretty substantial economic impact on that local community as well. So now to kind of shift gears, and I know people are probably interested, so wanted to make sure and cover some of the regulatory, because that's some of the biggest questions that we get, are what's happening in the regulatory environment in these different states. So a quick overview of the entire U.S. We saw this in 2008. There was just a few states that had some sort of language or passed some sort of regulation for telepharmacy. And if we fast forward then to 2016, this is pretty accurate. Things are always changing, so we try to keep this as up to date as possible. You're seeing a lot more states are starting to see this, see that other states are doing it, see that it's being implemented and used successfully, and developing language. Obviously you can see by this map it's used a lot more in the western side of the U.S., but we are seeing a lot more states in the eastern side start to pick up and take interest in it and start to explore language. And I think I'll speak for our regulatory team here at Telepharm. I can tell you that they would argue that any state needs to have language ahead of when they really want to start exploring this or utilizing this type of service. It's really important to be ahead of the game. And so having some language around telepharmacy, and exploring that now, or updating your language in each individual state, is something that we should start right away. It's not something we should wait to do later down the road. Um, Here's a quick overview of the state regulations throughout the NRTRC states. So I put in here, and I believe you can download this slide deck. So I wanted to have links to those different rules for everybody to be able to access and go and review on your own. time. But just a quick rundown. I can go through each one. So Alaska, it's definitely allowed in Alaska. Um, the some of the quick notes about it are that it's on a 10-mile radius, and they actually call it in Alaska, they call it a remote pharmacy and not a telepharmacy or a remote dispensing facility. But their rule right now says 10 miles, and if a pharmacy opens within 10 miles, then they need to revisit the license for that telepharmacy location. But obviously, a very rural state, very great place to take advantage of this type of technology. Idaho, and I'm just going in alphabetical order here. Idaho right now requires approval, but we actually have been working with a few individuals out there, and I know the board and other individuals in the state are working on updating their language right now to be more in line with where things are today, and they're making some great steps forward, and we're excited about the changes that are going to be made. We're expecting those new updated rules to be in place before the end of this year. Montana, it's also allowed. They have a 20-mile radius, and you'll see as we go through this that each one of these states is very different, and there's some definite fragmentation between the different states. We'd like to see more states be more consistent with what their rules are, what the rules and regulations are, and how it's implemented. But Montana has a 20-mile radius. They actually refer to it as I believe a remote dispensing facility, and they have a quick requirement on there that's a little bit unique as compared to other states. That their certified technicians that work in the stores have to have a minimum of 500 hours, which is really good to have some sort of requirements around the technician hours and when they're working in the telepharmacy. Um, we have Oregon up next. It's allowed there. It's a little bit different. It actually requires individual approval by the Board of Pharmacy. They refer to them as remote dispensing facilities. And here, I think they need to. I think that a lot of these states could use a little bit more definition and updating of their rules, and we're happy to work with the regulators in any of these states. But I know that Oregon, there is that statute there that says that you can go before the board and prove the need and be approved on an individual basis. Um, we also have Utah, which it's also legal. It's a little bit vague as far as the language is concerned. They call it a branch pharmacy or a drug outlet, which is kind of unique. And they have a rule where it needs to be inside a remote rural hospital or rural clinic in a remote rural county, and they have some definitions around that as far as what that means and where it can be located. But overall, they do allow for it just in specific circumstances. Washington requires a waiver from the board. They do have that put in. There is a lot of language in there that can be interpreted, and I think as we're preparing things for this presentation, Washington is probably the best example of a place that we'd like to see them put more definition around telepharmacy itself. A lot of the rules are based around telemedicine, but they apply to telepharmacy, and we'd like to see some definitions specifically for telepharmacy and some rules for telepharmacy. So when they are approached and when this does come, because it is something that's going to come here in the near future to every single state, that they're prepared and have things in place for that. And then the last one on the list is Wyoming. They have a 25-mile radius from the nearest telepharmacy or the nearest pharmacy, and they're also looking to update their rules. I think they're open to the idea, and they can see the value that it can bring. And so I think we'll see some changes and some progress there in the coming months as well. Um, Really quick here to just cover each one of the states. I wanted to give everybody an idea on the research that we've done here at Telepharm. We've noticed that there's a lot of research out in the marketplace on healthcare professional shortage areas, medically underserved areas, all these things. But not a lot of research into where pharmacies are not in relation to to communities and where people live. So we have undertaken our own research and gone out and looked at communities and found identified communities that are again meet our definition of a pharmacy desert. So they're 10 or more miles from the nearest pharmacy. And we have these lists. I'm happy to provide these to anybody who's interested in seeing the lists or wants to know where these are located. Um, we what we do is we create a list of communities and we look at each community to see do they have a health provider locally, and then do they have a pharmacy or not, and then what is the distance to the nearest pharmacy. So we're able to show that, for example, in this particular slide, Alaska has 44 pharmacy deserts. So there's 44 communities that are over 500 population, which there may still be use cases to have telepharmacies in under 500 populations given specific circumstances. But there's 44 communities across the state that would qualify and that are 10 or more miles. And there's 32 communities that are at risk, and we call at risk communities communities that have only one pharmacy. And the reason we call them at risk is that the industry and the situation for pharmacies is not getting any easier. Reimbursements are declining every year, and it's going to be more and more of a challenge. And so these communities are at risk of losing their pharmacy and becoming a pharmacy desert. So those are areas we want to focus attention on and make sure that minimally we can maintain their service throughout the years. And so we total up all the residents right now in Alaska that live within those city limits as defined in the census, to be about 65,000 residents that live in those pharmacy deserts. I did the same research and statistics for each one of the states here in our TRC. So Idaho, they have 28 pharmacy deserts, again 10 or more miles from the nearest pharmacy, with 24, almost 25,000 residents living in those areas. Again, that's not counting the residents that are outside of the communities or outside of the incorporated areas. And there's 25 communities that only have one pharmacy and they're at risk of becoming a pharmacy desert. Montana, very very similar situation. You see, they have 35 pharmacy deserts across the state. There's almost 34,000 residents in these pharmacy deserts. There's 61 at-risk communities, and these are all areas that we look at, and we really want to make sure they don't lose their pharmacies, specifically the at-risk communities. But these pharmacy deserts could definitely benefit today from a telepharmacy in their local community. Oregon, we see the same, with 31 pharmacy deserts and 41,000 residents, and then 44 communities that are at risk. And sometimes to me these statistics don't look huge, but there are a lot of residents that are living in these areas that could really stand to benefit from services like this. And you see here that a lot of those communities are not in the mountainous areas of the east side of Oregon, but there are some out there that are very, very rural and without pharmacy services. Utah, a little bit less, a little bit fewer pharmacy deserts, only 27, with about 26,000 residents living inside of those communities. And there's 26 communities that we've identified that are at risk of losing their pharmacy. Washington, again, a very similar story. 30 pharmacy deserts, 30 almost 34,000 residents in those pharmacy deserts, and there's 62 communities that are at risk, which is actually pretty high. And we'd like to make sure that Washington has good rules in place so that those communities don't lose their pharmacy services. And then finally, Wyoming, there's a smaller population in Wyoming, but there's 15 pharmacy deserts that we've identified, 13,000 residents, and then 14 at-risk communities. So I know that was a lot of numbers and statistics, but I wanted to make sure that anybody who joined from any of the NRTRC states would have information on their local state. Like again, I'm happy to provide those lists and the research that we've done. Feel free to reach out to me or to Martha after the webinar, and we'd be happy to get that information to you. Last but not least, I just wanted to cover a couple of things here to get people excited. the really cool thing about telepharmacy and the model that we're seeing take hold across the Midwest and in other areas across the U.S. is this idea of having to have this physical brick and mortar space so that you can house the drugs. Really has a lot of advantages, and what we see when we start to vision out where this is going and what's going to happen in the future is these pharmacies, these telepharmacies in these communities are going to turn into small little health hubs. We started to realize that we're providing a connection to from this local community to a pharmacist, but it doesn't need to be limited to just a pharmacist. We can also provide services for other specialists, other doctors, excuse me, psychiatrists, other things. So it's really exciting to see where this is going to head in the future, and how this is going to affect how rural areas are starting to get their healthcare needs met. We're going to see a lot more on the video counseling side of things over the next few years. That means access to pharmacists from anywhere. These are in our opinion, underutilized resource. The pharmacists are underutilized in the healthcare system and the healthcare team, and so giving access to them, direct connection to patient rooms and hospitals and health systems. Speaking to your pharmacist before you go home in that transition from hospital to home, or hospital to nursing facility or long-term care facility. Even, we're going to start seeing a lot more and more on your cell phone. You can be sitting at home, and you can speak directly to your pharmacist and get his or her expertise right there from the comfort of your own home. We're also going to see more and more areas provide 24-hour coverage with their pharmacists. That's not only in health systems, but that can be your local community pharmacy. Rather than it just be limited to larger chains, you're going to see smaller chains be opening and staying open as a telepharmacy for 24 hours. We believe you'll start to see that. And then a lot of pharmacists, people don't know that a lot of pharmacists struggle with finding relief help for when they want to go on vacation, or when they want to do other things, like go to lunch, or close the store at 5 p.m. They're gonna have that option to have a relief pharmacist come in and give them a day off, give them a break. So they'll just use their pharmacy as a telepharmacy for that time, and it'll help them manage their life and have a better work-life balance for them. So that kind of brings me to the end of my portion of the presentation. I wanted to make sure and leave some time here in case anybody has any questions and they want more information. My contact information here is on the screen. Feel free to reach out to me via email or phone. I'm happy to provide any additional information, resources, connect you with people that we know in the area that might be interested. We can connect you to regulatory people. We can connect you with other people who are doing similar things in other areas, so you can do some information exchanges, and all kinds of different things. So if we can be a resource, any of that research that we've done, please do let us know. And if you want to stay up to date on anything that's happening in the telepharmacy world, we have a great newsletter that we send out once a week that has updates on industry trends, regulations, to see what's going on around the U.S. As far as regulation is concerned. And if you hop over to our website, telepharm.com, there's a sign up form that you can get and start getting that newsletter delivered to your inbox once a week. So with that, I'll take any questions that anybody has.
Thanks, Greg. Like Greg said, if anybody has any questions, please put them in the Q&A pod below, and Greg will be able to answer them.
So Anil writes here, what is the best model for a telepharmacy, hub and spoke? Let's see. I would definitely say that hub and spoke is what we see is the best model. It really depends on the size of your operation and what you're trying to accomplish. If it's only going to be one or two locations, those can be handled a little bit better. State law may also determine how you need to set that up. For example, I know this is not in the NRTRC area, but in Wisconsin, they require that all prescriptions are verified by the same host pharmacy. So you need to have one host or managing pharmacy for that telepharmacy. So a lot of times for staffing and lots of other reasons, then having one main site and having the spokes come out from that for the telepharmacy sites is typically the easiest and best. But again, it really depends uh, on your situation. And I think I accidentally just closed that question somehow. Um, is there a way for me to see that question again here, Martha?
I don't think so.
All right. So Anil, I hope I answered your question. If not, let me know and I can add more to that.
And for anybody who wanted to see the slides that Greg had put up, especially on the state regulations, those are in the files pod. To the bottom right-hand corner, you can click on patient care through Telepharm and then click download file, and you'll have the slides from today's presentations. Give it a couple more minutes for questions.
Okay, Neil also asks, what is the best business case? Is there a way to generate new revenue stream from telepharmacy? What is the first step in establishing a program? So I'd say there's a lot of different business cases that we see used for telepharmacy. Um, we can definitely help you evaluate any potential sites or locations based on prescription volume. We're happy to help provide projected financials for the location. There's a lot of different uses that we're seeing more and more pop up. I know a lot of people have been talking about 340B. This has been a big interest to a lot of people, is being able to provide 340B prescription services with a telepharmacy. And that can be very, very profitable for everybody involved in that relationship. So yes, when you start talking about, is there a way to generate a revenue stream from the telepharmacy? Absolutely. Not to get too much into the weeds on this, but we typically see the pharmacist is the largest cost to running a pharmacy. And so when you switch to a telepharmacy model, you're able to extend that pharmacist reach out from the one physical location to doing multiple locations. Those additional locations will actually, we approximate it to be about a third of the cost of running a traditional pharmacy. Now, of course, that varies on a lot of different factors, but that's kind of our rule of thumb, is it costs about a third as much. So there's definite opportunities. I think when you look at 340B, when you look at serving a larger patient base, you're going to be filling. When you look at some of the statistics, you're going to be filling more prescriptions. So we've even found that pharmacies that are opening, we've had telepharmacies open within 7 or 10 miles of the nearest pharmacy, from the same pharmacy owner, and we haven't seen any kind of backlash with their prescription volume. We actually see their prescription volumes increase. So definitely there. And then of course, I think the other revenue opportunities when it starts coming to telepharmacy is, you're getting more access to those patients. You're having more interactions with them, and that also gives your pharmacist more opportunities and pharmacy technicians for that matter, to build relationships with those patients, and start to integrate those additional services that pharmacists can provide. Most telepharmacies most state laws require that a pharmacist is there on site at least once a month. And we see a lot of the people that we work with, they'll have pharmacists on site more often than that, usually on a regular schedule. And that way everybody knows when that pharmacist will be there, and that pharmacist can do the CMRs, the MTMs, give immunizations, do those other revenue generating activities that can be provided right there on a local level. So really, I think there are a lot of additional revenue opportunities that you can get through a telepharmacy. And then the first step in establishing a program, just to answer your final question there, is I think the first thing is to identify a potential location. That's start looking around. We're happy to provide our research. If you know of other locations that you're considering, we're happy to help you evaluate those locations based on what we've seen, the success rate of other telepharmacies around the country. Um, and then work with your like make sure that you work with your regulatory authorities to make sure that we all of us understand exactly the requirements and what needs to be done. Many states it's an application that you're just going to fill out, and then you have to meet certain requirements of distance to the nearest pharmacy and other policies and procedures. But that's pretty much the first step I'd say is identify that location where you're interested in, and we can evaluate that and say yes, this would be a good location, or no. We would recommend finding another location. Then looking into the regulatory and licensing side, and then the final step would be actually planning out the construction if that's necessary of the telepharmacy, and getting everything set up the way it needs to. And of course, our company as well as others out there will help you design your floor plan, your workflow, get everything set up the way it needs to be set up, and help walk you through all those steps. But it's pretty much the same as opening and operating another pharmacy. Like I said, the only difference is there's just a small regulation piece as well as the licensing of that pharmacy as well. Any other questions?
Yeah, I'll go ahead and let everybody know that we're going to put up a survey. If everybody could please complete that, that helps us to better cater our monthly webinars to what you guys are wanting to learn about or wanting to hear more about. So I'll go ahead and put that up, but you can still enter in questions if you have them too.
Great. And again, I'll just say thank you to everyone for letting us, especially to NRTRC, Martha, and everybody there, for allowing us to come out, and appreciate it. And happy to help out with any questions you might have. A couple of little quick questions here that I saw pop up. We do have a newsletter on our website. If you want more, it's very easy to subscribe to. Just hop on our website. You'll see down in the footer there's a little subscribe field there, so you can get information and updates. And then if there's anything else, I'm happy to provide information and other resources to you.
Okay, it looks like we've got all the questions in, so I'll just say thanks, Greg, and don't forget that we've got a webinar on the 23rd of this month. Cindy Roloff is going to be doing Telehealth 101, so we will see you all then.